Hello, my name is Dr. Sandra Hardee, and I'm the Medical Director of Prisma Health's Occupational Health Services. This is another one of our lectures that we're doing for our client companies or potential client companies to learn a little bit about what we do in occupational health. Um, this month, I'm going to talk about pre employment physicals. This is something that we do every day in all of our offices. We partner with several hundreds of companies actually who will send potential new employees over for a physical. This is to ensure that they're safe to be able to do their job. And there's a lot of advantages to doing these pre employment physicals that you may not understand. So let me um, share some slides with you. Okay, great. So I have my name here, and also I have my email address, which is sandy.hardy@prismahealth.org if you ever need to contact me. And all right. So there's five main reasons employers may conduct pre-employment physicals. One is obviously to make sure that they're able to perform the essential functions of their job. It can also help screen out applicants who may have several chronic health conditions that may make it um, such that they may not be able to perform that job, or that the employer may look at placing them in another position. Also, by performing these physicals, you're promoting a culture of health and wellness. Actually, as you look at number four, some states require pre employment physicals for certain types of jobs. And it also streamlines the hiring process. So, say you're looking to hire certain individuals, requiring certain demands for a job. If you go ahead on the front end and get this physical done early on, it may save you time and money in the long run, avoiding other additional testing such as blood tests or drug screens, things like that. So there's several different types of physicals and broad categories. We do DOT physicals, obviously, return to work. That may be, say, someone is out of work for they need bypass surgery, something not related to their work, and they're out for several weeks. They may need to return to work to go back to their job duties. Fit for duty, we do general physicals, and of course, some physical ability testing can be done as well. So, what are the advantages? This is something I think companies really need to think about. So, if you send an employee for a pre-employment physical, you can be reassured as the employer that the worker is physically competent to perform their assigned duties. So, what a lot of companies don't realize or individuals don't realize is that we have several hundred companies that send their employees to us. For every employer that we work with, for every job for that employer, we have a job description. So when we see a person in the office, we will attach that job description to that physical so that we can really make sure that they are capable of doing everything listed on that job description. So that gives the employer a lot of reassurance. Also, an advantage is employees will not be performing jobs they shouldn't be doing because of a pre-existing impairment. So if we're seeing an individual and say they've had some sort of orthopedic surgery, say to their lumbar spine, they've had a fusion or a laminectomy, we can evaluate that and then make recommendations stating, just as an example, should not lift above 50 pounds. That way, the employer is aware of that and can make sure that they can accommodate that. That's very, very important because it'll protect that individual from future harm at work. And also, it can avoid workers' comp claims related to non work related uh, injuries. So, if you know that there's a pre existing impairment, then it will help prevent that individual from claiming that it was work related later on. There's been several studies to show the importance of pre-employment physicals and that it helps save money because if you go ahead and spend a few dollars on the front end getting these physicals done, it can definitely help uh, in terms of having fewer accidents, injuries, or worker compensation claims. So each time we do one of these physicals, I know for myself and the providers at Prisma Health, we want to really tailor the physical to that job. So, for instance, in really safety sensitive positions, like you see here on the slide, like a DOT physical, we need to make sure that that individual doesn't have any kind of medical condition that could cause them to become suddenly incapacitated. They're driving a truck, could be a small box truck, could be a larger 18-wheeler. We need to make sure that they don't have any kind of heart arrhythmias, any seizure disorders. So we go through a very long list of questions in their medical history, make sure that there's nothing that could cause them to lose consciousness. Same thing as you see here, we see folks who are crane operators, forklift drivers, pole climbers, anyone working at any type of height, firefighters, any kind of safety sensitive position. It's very important that we do a thorough physical to make sure that they meet all the criteria for that position. So some of the things that we look at, as I mentioned briefly, is you want to get a good cardiac history, history of any seizure disorders, make sure if they're diabetic, that they're well managed, that they're not a real fragile diabetic, inquire about any prior strokes that may have left them with any deficits. Also, it's important that you want to review all their medications in detail, particularly if they're on any pain medications, sleeping medications, anything that could make them drowsy, anything that could affect their ability to operate machinery or heavy equipment. They definitely cannot be at work while they're using these medications. So typically, if there is an instance of this, we'll recommend that that individual get off of those medications before they're cleared to work. Again, what we're trying to make sure is that person's safe to work and that it's also safe for others in that environment around them, uh, and that around them so that they don't get injured as well. So a common thing we really spend a lot of attention on is orthopedic injuries, particularly in manufacturing world, where again there may be a level of moderate or heavy lifting involved, or any kind of strenuous activity. So it's essential that we get a very detailed history of any surgeries, any retained hardware, old injuries, if there's still any ongoing therapies such as physical therapy, if they're still on pain medications. We definitely evaluate all the joints, major joints, shoulders, knees, spine, etc., and also evaluate for hernias. So, as part of the physical, we want to look for scars, anything to verify the history that the patient has written down and that we've discussed. So, if they've claimed they've had knee surgery or back surgery or hernia surgery, we want to make sure that we see scars. Sometimes we'll see a large scar over a joint, and that tells us they've had a surgery that they didn't claim on their form. So, then that prompts us obviously to inquire about what they've had done previously. We want to make sure that all their joints have a full range of motion, that they have a normal gait, that they have good balance, they can make a deep squat, etc. So part of the pre-employment physical, also we offer multiple ancillary testing. So this can include anything from hearing and audiology testing to vision screening. Again, for say driving, it's very important that they have adequate vision acuity. EKGs can be offered. We do a lot of pulmonary function tests as part of our respiratory clearance program. We do drug screening, TB testing, and vaccine titers. So these are several other ancillary services that we offer in all of our clinics to make sure, again, that that person is fit enough, is capable of doing all of their tasks for that job. So to kind of tie it all up, um, an individual comes to us, they've applied for a job, they've interviewed with you, you've gone over the job, you send them to us. We have that job description with them or in our office that we can evaluate with them. We do the physical, we do any other ancillary testing, and then it's up to us. Can this person in front of us, can they safely perform the essential functions of that job. If they can, great. We clear them that they're clear to work. If not, then we can make recommendations to see if there's an ability for that company to accommodate them so that they can work. So it's really we're working together with the employer and the employee to get the best outcome. It's not meant to be punitive, but what we're trying to do is to make sure that that individual is safe to work in your work environment and make sure that they're able to perform their essential job functions. You don't want to hire someone and then 3 to 6 months later find out they've got, some significant orthopedic issues or other issues that are impairing their ability to work, or more importantly, making it unsafe for them to work. And then they get an injury on the job, and then you're going through a workers' comp claim and going through that process. And we're trying to help you avoid all of that. So again, pre-employment physicals are very, very important in our view. So that's sort of a 30,000-foot look at pre-employment physicals. We do these every day in all of our clinics. As I'll mention again, we have 4 offices throughout the state, one in Greenville, Seneca, Columbia, and Sumter. As you can see on this last slide, Prisma Health. If you go on our website, prismahealth.org, you can look under Employer Health Services. It tells you all the services that we offer, and you can contact us. There's contact information on there. If you'd like to contact me, please feel free to. Again, my name is Sandy Hardee, SANDY.HARDEE at prismahealth.org. And you can see my Christmas tree behind me. So it is December. It's a couple of weeks before the holidays, or before Christmas specifically. So I wish you all a very happy holiday. Thank you for watching.